Hi everyone, myself Dr. Saiti, team MDSCONQUER. So the next topic from the anatomy that is going to be discussed is the salivary glands. So physiology of saliva and the anatomy of salivary glands are equally important. They can be asked in any of the basics paper. So let's discuss. So for the essay question, it's always important to write the contents. So these are the contents which you need to write for the anatomy of the salivary glands. So do write these contents. Okay, all these contents is better if you write. Then you can give a simple introduction of how the salivary glands and saliva plays a very important role in maintaining the oral as well as the systemic health, and any other introduction if you want to put in, you can put in there. So how the saliva aids in speech, in deglutition, in digestion, in antimicrobial effect, in lubrication, and anything, whatever you feel you can put in there. Okay. So, and again you can write as there are three major salivary glands. So simple introduction you can give. So next you can jump for the development of the salivary gland. So this is a particular development of how you have to mention. So when mainly the intrauterine life of when the salivary glands of that particular salivary gland is being developed, that you have to write first. So as in you can see, the 6th week is a parotid and submandibular. The 7th to 8th week of intrauterine life is a sublingual, whereas the 3rd month of intrauterine life is a minor salivary gland. So within the first trimester of pregnancy, almost all the salivary glands are being formed. Okay, and the development actually occurs in these 6 stages. Okay, so you can just name the stages, and if possible you can draw a diagram related to these stages. Okay. So mainly you have to write the 6 stages, like the bud stage, the bud invagination, the pseudoglandular, the canalicular, terminal bud stage, and nerve innervation. So if you can write, if you can name, and if you can draw a diagram related to that, then that will be helpful. So coming to the major classification, so classification of the salivary glands is very important. So based on the criteria, that is major and minor, and again based on the secretory system you have to classify. So coming to the major salivary glands, we know the 3 salivary glands is parotid, submandibular, and sublingual. Whereas the minor salivary glands again include the labial, the buccal glands, the palatine glands, and the lingual glands, and the glossopalatine glands. So all these are the major and the minor salivary glands, and based on the secretory system, what all come under serous, what come under mixed, and what come under mucus. So the parotid gland and the von Ebler glands are completely serous, whereas submandibular gland is predominantly serous. It's mixed, but it is predominantly serous, and sublingual it is predominantly mucus, and the mucus, completely mucus, are the minor salivary glands except the von Ebner. So you have to write this classification for sure. And now you have to individually describe the respective salivary gland. So first major salivary gland that you need to describe and give a good description is a parotid gland. So you can give its dimensions, you can give the average weight of it, and also you can give it as it has 5 processes, that is 3 superficial and 2 deep. Okay. So the headings have to fall in the development, followed by the classification, followed by the parotid gland, little description, and again coming to its details at the boundaries of the parotid gland. So inferiorly what are the boundaries, superiorly what are the boundaries, all that. So inferiorly you can see it is the anterior aspect of the sternocleidomastoid. Okay, and superiorly it is the inferior margin of the zygomatic arch, posteriorly the border of the mandible, posterior border of the mandible, external auditory canal, and again anteriorly it is a superficial aspect of the posterior aspect of the masseter. So these are the various boundaries that you need to write. So if you can draw a diagram with showing the ear and the mandible and the parotid gland, that will be really fetching. So diagrams are always fetching, students, so that will attract the examiner. So wherever you can put a diagram, if you can draw a diagram, it's better you draw. Okay, next coming to the parotid fascia. So the parotid has its own fascia which is called as capsule. Okay, and it is continuous, the superficial layer of the deep cervical fascia. Okay, so it has this fascia again has superficial and the deep layers. The superficial layer extends from the masseter and sternocleidomastoid to the zygoma, whereas deep layer extends from the fascia of the posterior belly of digastric, wherein it forms a stylomandibular ligament which separates the parotid and the submandibular gland. So this is very important. If you write, it will be really scoring. Okay, and again the attachments of the fascia includes the parotid of the parotid fascia includes anteriorly it's a mandible, inferiorly it is stylomandibular ligament, and posteriorly styloid process. So if you can write related to fascia, it's very like fetching. Okay, so next coming to the duct. So every salivary gland has its own duct, so if you can mention that again the duct and its important characteristics, that will be again useful. So Stenson's duct is for the parotid gland. So the course of the duct also, if you write, it's useful. So for example, this arises from the anterior border of the parotid and parallel to the zygomatic arch it runs away, and then 1.5 centimeters, that is approximately 1 finger breadth inferior to the inferior margin of the arch. Okay, it runs parallelly like that. And Stenson duct runs superficial to the masseter muscle and again turns medially 90 degrees to pierce the buccinator and at the level of maxillary molar, and again at the level you know where the Stenson duct is seen intraorally, that you can mention. Okay, this is how you have to write about the Stenson duct. Then you can write the nerve supply of so the preganglionic parasympathetic from the C9 nerves arise in the otic ganglion via lesser petrosal nerve, and postganglionic fibers leaves its otic ganglion and distributes the parotid gland via auriculotemporal nerve. This nerve supply is very important, students. Okay, and sympathetic is from the postganglionic fibers from the superior cervical ganglion and distributes to the arterial system, along the arterial system. So mainly the parasympathetic innervation is very important. Again, this individually they ask it as a very short answer, so do remember this. So the otic ganglion, the lesser petrosal nerve, again the postganglionic fibers leave the ganglion and supply the gland via auriculotemporal nerve. So you have to write this for sure. So again the facial nerve, we know it actually enters the parotid gland, it innervates it, and after exiting it gives out its 5 terminal branches. So that if you can write, it's very good. So upon exiting at the stylomastoid foramen, it gives these branches, and after it exit the foramen and this enters into the goose foot, like you know it's a goose foot of it looks like a goose foot, and approximately 1 centimeter from the stylomastoid foramen it gives out its 2 divisions, and the cervicofacial is followed by its 5 terminal branches. So you can briefly mention of how the facial nerve innervates and again leaves out the parotid gland and gives its 5 branches. You can just mention, that's enough. So coming to the other nerves, that is a greater auricular nerve. It's deep to the superficial around the posterior border of the sternocleidomastoid, posterior to the external jugular vein, and the parotid fascia is innervated by the sensory fibers of this greater auricular nerve. Okay, so it is a nerve that is first encountered in the surgery. Next, auriculotemporal nerve, we have already discussed the parasympathetic fibers from the otic ganglion. Okay, and the sensory fibers as from the trigeminal nerve. So this is how you have to write. You have to give the nerve supply. So especially the nerve supply of the parotid gland is again asked. So you have to write, students. You have to mention all the nerves, auriculotemporal nerve, the trigeminal nerve, the facial nerve, all these nerves you have to mention, and if possible put a beautiful diagram. Okay, and the blood supply is by the retromandibular vein and the external carotid artery. Okay, so the lymphatic drainage is again to the superficial and the deep cervical nodes. Okay, so that's it. So for every gland you have to write little bit of its introduction, okay, of how does it look, if it has a fascia, like for example parotid has a parotid fascia, okay, and then you have to give its boundaries and its attachments, and apart from that you have to give its nerve supply, its blood supply, and its lymphatic drainage, okay, and the duct related to that particular salivary gland. So this is how the entire part of that particular structure will be covered. Okay, so next coming to the submandibular gland. So this gland is, again we know it lies in the submandibular triangle, which is formed by the anterior and posterior bellies of the digastric muscle and the inferior margin of the mandible. So it is a it forms a C shape around the anterior margin of the mylohyoid muscle, where it divides the submandibular gland into the superficial and the deep nodes or the deep lobes. Okay, the marginal mandibular branch of the 7th cranial nerve runs superficially to the submandibular gland, and then deep into the platysma. So this is the mild introduction that you can give, simple introduction for the submandibular gland. If possible, you can put this diagram. Okay. So next, coming to the gland relations. So every gland you have to write its relations and its boundaries. So superficially it is to the skin, the platysma, the capsule and the cervical branch of the facial nerve and the facial vein, and deep relations are against the mylohyoid for most of the part, and posteriorly to the lingual nerve and the hypoglossal nerve. So these relations you need to put in. And the Wharton's duct, it's not Wharton's, it is Wharton's duct. Whortons, the spelling mistake. So it's a Wharton's duct which arises from the deep part of the gland and runs from the open side on the lingual frenulum. Okay, lingual frenum. So this, where it opens, you have to write, and the lingual nerve actually loops around this duct. So these 2 points is very important. And the blood supply is the facial artery and the facial vein. So the nerve supply is the preganglionic fibers from the superior salivatory nucleus through the sensory route, that is chorda tympani in the facial nerve, reach the submandibular ganglion, and from where the post ganglionic fibers actually innervate this submandibular and the sublingual gland through the lingual nerve. Okay, so it reaches the post ganglion, it reaches the submandibular ganglion through chorda tympani, and again it innervates the submandibular and sublingual via lingual nerve. So this points we have to put in. Next, coming to the sublingual gland, it is the smallest of all. Okay, it weighs about 2 to 3 grams, and it doesn't have any true facial capsule. It lies between the floor of the mouth and mylohyoid. Its duct is called as a Bartholin's duct, okay, which opens with inward adjacent near to the Wharton's duct. The Wharton's duct is the submandibular gland duct. Okay, and in most of the cases it has again consists of smaller ducts of Rivinus. This points you can put in for sublingual gland. So the nerve supply is similar to that of submandibular gland, and blood supply is from the lingual and the submental arteries and veins, and lymphatic drainage is to the submandibular lymph nodes. Simple. So every gland has to have its nerve innervation, its blood supply, and its lymphatic drainage, its relations, and its duct. So these 3 major salivary glands, you have to write all these, the boundaries, the duct associated, the attachments, okay, and if it has a fascia, the attachments of the fascia as well, and then the nerve supply, the blood supply, and the lymphatic drainage. So these are very important for all these 3 major salivary glands. So coming to the minor, so the minor are present on the labial and the buccal glands, or the glossopalatine glands and the palatine glands and the lingual glands. So the anterior group are called as the glands of Blandin and Nunn, okay, which are near the apex of the tongue and a mucus character, whereas the posterior are present posterolateral to the circumvallate papillae. Okay, this is just a simple introduction is enough. So even if anatomic part is being asked, then you have to write what all we have discussed so far, and then little of physiology you can add. Okay, already we have been discussing the saliva in health and disease, the physiology part also, so you can put some points from there and you can just add. Okay, so physiology you have to give this, like serous secretions and the mucus secretions, what are the importance of that. Okay, and then what is the contribution of the glands towards the secretion. So this is very important. So, okay, this is very important of what is the exact contribution of the stimulated and unstimulated saliva towards the salivary secretion. So if you put this, it will be really fetching. Okay, and you can highlight that as well. And then how the saliva is being produced, what's the primary and the secondary or the ductal secretion. So the primary is through this transport, that is sodium potassium chlorine co-transport, and it occurs which actually contributes to the primary fluid or the plasma of the saliva, the primary fluid of the saliva. Okay, then ductal secretion is actually, it adds to the ionic composition of the saliva. Okay, so that could be other like bicarbonates, potassium and all that, which adds to the ionic composition. So just minimum production of the saliva, if you write, it's enough. So and the other functions, as you know, the antibacterial, the lubricating, the digestive functions, and how it moistens oral mucosa. Okay, all that, the buffering capacity, and also the prevention of caries. So it is actually, it acts as a protective pellicle over the teeth, so it is called as a protective pellicle. And the immunological factors, like it has IgA. Apart from IgA, also it has other immunoglobulins like IgG and IgM. To minor quantity, it does have that. So these are all the important functions of the saliva that you need to note it down. Okay, and then the clinical aspects you can end in. So you can just write the headings, and if required you can write any important points related to that, like xerostomia, siluria. Silidinitis is inflammation of the salivary glands. Okay, Silosis is a non-inflammatory, non-neoplastic enlargement of the salivary glands. Silolithiasis is nothing but it's related to the ducts, inflammation and the occlusion of the ducts. Okay, and the benign and malignant tumors. If you can remember from your undergraduation any points, then you can write there. Okay, so every question has to end up with the clinical aspects, because that will add on to your marks. So little, at least one page on clinical aspects, it's very important. Okay, so that's it, and you can give these references, it's up to you. Actually basics paper, it's not that important to give any article references, but if you can add some references, it's okay. So this is how you have to answer for the salivary glands. So mainly you have to write the anat part, after which you have to followed by which you can write the physiology part. Simple physiology aspect is enough if anatomy question is asked. If a physiology question is asked, then simple introduction of anatomy is enough. So it's actually depending on whether they are asking as an essay question or a short answer. So based on the time and the management or you have to answer accordingly. So that's it. Thank you, students.